just going to talk about tobacco and the effects it has on oral health. I was got in an argument with someone online about this, and there's just a lot of misinformation. People believe it doesn't do anything to your oral health, and they think it's fine if you smoke cigars or just smoke a cigarette here or there, but it has a lot of negative effects, all forms of tobacco. I did a little bit of more research, just get a lot of solid sources like the CDC and a couple other research sources from PubMed. And basically these are main bullet points from the CDC that tobacco, if it's smokeless cigarettes or other types of tobacco, they cause oral cancer, cause gum disease, and other oral health problems. And brushing your teeth or using mouthwash or flossing, they're going to help, but they won't prevent the effects that tobacco causes. It also increases your risk of tooth decay. Those who use tobacco that are adults, they found that those who are 20 to 64 years old had a 40% higher likelihood of having untreated tooth decay compared to those who don't smoke. Also, those who are 65 and older who smoke, 43% of them lost all of their teeth. And smokeless tobacco, like chewing tobacco and such, it causes leukoplakia, which is like these white spots, like patches that form in your mouth, and they are precancerous, and there's a high likelihood of them turning to cancer. And it's something that in the dental field that you see a lot of is oral cancer, and a huge contributing factor is tobacco. I can't stress that enough. It is probably the biggest risk factor of getting oral cancer. So if you do use tobacco, you have to know that you are increasing your likelihood of getting oral cancer. It also damages your gums. There's these ligaments that connect to your teeth called your PDL or periodontal ligaments, and tobacco is going to kind of destroy that, and that's why you lose your teeth. And no amount of brushing or other oral hygiene is going to prevent that if you continue to use tobacco, especially smoking tobacco. And the reason why is because it gets rid of the immune cells in those around those PDL ligaments, and in your gums, there's a little sulcus that you have neutrophils and immune cells, and smoking and tobacco is going to get rid of those. It kind of prevents them. That's why your gums don't swell up a whole lot, even though if you use tobacco or smoke a lot, they don't swell up and don't look as bad. But then there's a lot of damage happening because the immune cells can't go and respond and fight back infections. But because the immune cells aren't there, it doesn't puff up or swell. But instead, you just lose your teeth and you just get cancer, and it really hurts you in an oral health aspect. So I would just recommend do not smoke, do not do any sort of tobacco. And I was reading some other articles that even just nicotine itself has a lot of those effects. So even vaping, it causes a lot of tooth loss and ruins that PDL ligament. I don't know if it has as many aspects with cancer. I'm not sure yet. I think the research is still pretty young, but it does still cause tooth loss. So just avoid smoking, vaping, tobacco in general. And then if you are using it, I would limit your use as much as possible, because it also reduces the amount of treatments that a dentist can actually do for you. I know with implants, you can't get an implant if you're smoking. If you want an implant, you have to at least stop smoking or any sort of tobacco for 2+ weeks, and then also multiple weeks afterwards if it's going to be successful. Because same thing, the attachment won't happen, and the bone won't integrate into the implant. So, and then there's a lot of other treatment options that are just taken off the table if you do use tobacco. So definitely do your best to stop if you do smoke, or limit it as much as possible, because even limiting it, and it's really about like kind of like frequency as well, like how frequent you do it. Like if you smoke like a cigar maybe once a month or once on the rare occasion, it's going to be way better than if you smoke daily or on a much more regular basis, because then smoking just those few occasions, it ruins your immune cells for that time. But then like if you only do it every once in a while, then those immune cells can come back. So if you were to like smoke like very frequently, I think the frequency is the most important part. Your immune cells won't have as much opportunity to grow back or get back into those areas. So just stop smoking if you can, or limit it as best as you can. And if you don't smoke or use tobacco in any way, don't start. It doesn't do any good for you when it comes to your oral health.